Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. We're in the kitchen to talk Thanksgiving food safety, and my next guest is Miss Andrea Bigelow, who's a nurse practitioner at Family Practice Associates. Welcome.
Thank you for having me.
Now, you talked a little bit about cooking a turkey, maybe good, maybe bad, but you do know at least a little bit about turkey safety or food safety. Tell us about the prep.
Yeah, so I do not attest to being a gourmet chef, but I have a couple of tips just to try to keep your guests from getting food poisoning.
It's always good.
Yeah, so we just want to make sure that it stays in the packaging that it comes with. If you're going to freeze your turkey, you want it to be in 0 degrees Fahrenheit or lower. And then if you're going to de-thaw your turkey, we recommend putting it in the refrigerator in the original packaging so the juices that contain some of that bacteria is self-limited or contained. And then you'll want to de-thaw it for 24 hours for every 4 to 5 pounds. And the label will tell you about that. The other ways that you can de-thaw turkey is also in cool water or in a microwave, again going based upon what the label tells you how to do that. But we do not recommend de-thawing on the counter. Bacteria can grow in that danger zone between 40 degrees Fahrenheit and 140 degrees Fahrenheit. So it's just really important to make sure that you're de-thawing it safely and that you're also cooking it safely.
Well, now, you mentioned on the counter or in the sink. You've got to be careful about cross-contamination and getting things dirty. So what's the worry there? Yeah,
so you just want to make sure that you are prepping your turkey first or prepping your other side dishes first. You don't want to kind of mix around because there's risk for contamination. You're wanting to use separate cutting boards, separate utensils, and then washing the surfaces in your hands and utensils with warm soapy water, or using completely separate cutting boards and separate utensils for your turkey versus your vegetables. So when you cook your turkey, you really want to make sure that you're cooking it thoroughly. The new recommendation is actually not to cook the dressing or stuffing inside the turkey, just because that can introduce bacteria into the stuffing if it doesn't get as warm internally as you may think. Your turkey comes with that little pop-up timer on it, and we don't want you to rely on that. We would really recommend looking at a meat thermometer. The recommendation is to actually check 3 separate places to make sure that your turkey is cooked to 165 degrees Fahrenheit all throughout, or at least in the thickest part of the turkey. And then just making sure that when we're done with the turkey that we're putting away leftovers 2 hours after it comes out of the oven. And then if you're cooking any other surface or any other vegetables or other side dishes, that you're just really wanting to make sure that you're cleaning everything. And when I'm talking about cleaning also, as far as washing, a lot of people have the bad habit of washing poultry before they're cooking it. So the turkey trying to wash juices off of it, or chicken, it's really not recommended because we can actually introduce bacteria all throughout our kitchen and kind of cross-contaminate surfaces and not realize that we haven't cleaned that area. So it's not necessary. The cooking process will take care of that bacteria.
Now, you mentioned washing. Not only you talked about washing or not washing the turkey, but vegetables, you need to clean them too at times.
You do, yes. So you want to run those under the sink water and just make sure you're washing those. And again, just making sure you're washing your hands, warm soapy water and those surfaces in between.
Washing hands between things, keep things separate, clean, to prevent the cross-contamination. Now, we talked about storage, and if you don't do that right, or you don't cook your turkey right, you could give some of your guests food poisoning.
You could, yes. And so just making sure that you're putting it away, and also if you're storing it in the refrigerator, you can really only store it in the refrigerator for 3 to 4 days. So just making sure you're keeping an eye on that too. I always recommend, I know my mother-in-law loves to do it, is write the date on the bag of whenever you're putting something away, so that you kind of know what date and time you put it in there, so that you can put it in the freezer.
Let's say you do give one of your guests food poisoning. What are some symptoms you need to worry about?
Yeah, so some symptoms of food poisoning in someone who has a healthy digestive tract or is a healthy individual may experience fever, they may experience nausea, vomiting, diarrhea, abdominal upset or cramping, and dehydration.
Are there worrisome symptoms you need to see your doctor?
Yeah, so obviously the main complication of food poisoning is dehydration. So signs of dehydration you want to look for is, especially in children and the elderly, some symptoms would be mental confusion, dizziness, fatigue, low blood pressure. The other that you would want to focus more on the pediatric patient would be if they're crying and no tears are produced, or if they're having less than 6 wet diapers in a day, or no urine output for 3 hours or more. And then, the adults need to be proactive as well. So if you're having more than 6 loose, bowel movements in a day, or your symptoms, nausea, vomiting and diarrhea, are lasting longer than 3 days.
Okay. Well, one last thing to wrap it up. If you have diabetes, you want to be a little bit careful.
Yeah, so Thanksgiving. So you're wanting to make sure you're limiting your sweets around Thanksgiving and just really focusing on limiting the carbs as well. We want you to enjoy your Thanksgiving, but obviously within moderation. The other thing we need to think about is adding salt. A lot of people add salt and pepper, but mainly salt to their turkeys, their gravies, and all. And when they're cooking, they add salt to everything. And we just really need to be focusing on that, as that can increase blood pressure as well.
So overall, if you pay attention, clean, wash, don't overdo the leftovers, watch what you eat, you can have a pretty good Thanksgiving.
Yeah, you'll be really healthy Thanksgiving, yeah.
We thank you for coming in. Thank you for the information that you've given us.
Yep, thanks for having me.
And we hope you have a good Thanksgiving and can avoid food poisoning by maintaining good food safety. When we come back, we're going to talk to God's Pantry.